On COVID-19, we have done more. When we were afflicted by the COVID-19 pandemic in March this year, we had only 8 infectious disease ICU beds countrywide. 7 days after the first COVID case was discovered, we were able to increase this capacity to 60. And today, we have 827 infectious disease ICU beds, up from 8 in March this year. During my 12th address on coronavirus pandemic, we had 7,411 isolation beds nationally. And this was achieved in only 6 months. But 3 months later, in December of 2020, this number has tripled and now stands at 20,910 isolation beds.
Nothing in this country has been neglected by the government. We have been looked down upon by everybody. And there's poor management of health, general health sector in the public sector. We want the payment of 30,000 shillings, an agreement on payment of 30,000 shillings for risk allowance for all nurses in the country. We want payment of salaries for UHC nurses who are contracted and those who are in other forms of dubious contracts. We want BSS interns to be paid for their salary. And we want payment of vehicle nurses, 15 months salary now. We want them to be paid in arrears and in full. Delayed remittance of third-party deductions. You cannot access medical cover, even the normal NHIF card. When you seek medication using NHIF card.
That the surging cases and infection amongst the healthcare workers is actually attributed by the fact of lack of training on safety measures, on COVID, and inadequate supply of recommended PPEs and indeed substandard PPEs within the medical fraternity. That up to date, the UHC staff have not been paid for over 6 months now, and including the interns who are serving in the same dire situation. Indeed, during this very risky and very needy moment, the health care workers and the clinical officers in this aspect continue serving with a health risk allowance that is not commensurating with the risk that they are involved in. That healthcare workers have been feeling demotivated because they do not have a comprehensive medical cover, life insurance, and actually a structure to ensure that they are compensated once they suffer or rather lose life in line of duty.
Well, then, a crisis within a crisis there. On one hand, President Uhuru Kenyatta outlining some of the successes in strengthening capacity in the healthcare sector. On the other hand, the drivers of this particular agenda on healthcare, those that are on the ground saying this government has neglected them, and it was very harsh criticism that have come up from Jamhuri Day, a celebration addressed by the president there, avoiding completely talking about this issue. And I know, Gabriel Muduma, we've talked about this before. I'd like to start from that healthcare workers have been complaining about neglect from the government, have been asking for the most basic of things to help them do their work. How do we look at this?
Well, you see, Akisa, even though it is happening at the time of COVID, this pandemic, which is ravaging, the entire country, the entire continent, and the entire world, this is not the first time the doctors have tried to talk to government to have or to set up a forum for their grievances. But like I told you last time, I think talking through the media and talking through newspapers and what have you, I don't think it will help. And you will agree with me. Every time we've found solutions is because we have sat down and looked at what we have and what can be able to be given out. That is the only way you're going to come up with a solution. It is sad that is happening at this time where now conditions are being set and conditions are actually being issued and threats are being given. But I still believe a solution can be found. And that solution will only come if the government and the health fraternity, if they sit down and discuss and talk things through. That is the only way we are going to realize a solution. Otherwise, if anybody, imagine, Akisa, if every person retreats to their position, what will happen? Who will suffer at the end of the day? Is it not the common Kenyan? That, to me, is my problem.
They already are suffering,
Totally.
at this point.
Exactly.
Do you think this is the year the government completely let down healthcare workers?
Well, it has been argued that, Akisa, it has been argued that, and primarily, doctors have raised a concern, and a major one, when they look at how the KEMSA issue was handled. They've also raised an issue on PPEs. They've raised an issue on their environment, also on how their shifts are actually, being worked out. And I told you last time, I totally disagree with some of these things, where a doctor comes from one shift and goes into another shift, where we hear cases of doctors who have not been paid, whether it's through the national government or whether it's through the county government. I do not think at this point is when we should actually be holding salaries or arrears for these doctors. And that's why I think, I'm telling you, Akisa, I think there needs to be a very tight conversation to see what is the problem, who is fumbling, who is dropping the ball?
Who is dropping the ball?
Exactly.
Okay, great. I want to bring in Director say at this point, who's dropping the ball really? And is this the year we completely let down healthcare workers, especially when we are dealing with a pandemic?
Akisa, I think this is the year we have indeed let down healthcare workers, and it's not the only year. There have been many years where we have let down the healthcare workers. First and foremost, I want to extend my utmost respect and gratitude to all healthcare workers and what they're doing on the front lines in spite and because of the lack of support that they have received from the government. It is an absolute tragedy that we have lost so many healthcare workers in the line of duty because they simply do not have, for example, PPEs. This is unacceptable. And we rise up as Kenyans and we protest and we decry, but we refuse continuously to unpick and be systemic. And I spoke about this earlier, Akisa. If we do not understand the genesis of the deep-seated corruption, the mismanagement, undermanagement in the healthcare space, we will continuously blame the wrong people or continue to divide ourselves. I'm also fascinated by the fact that the doctors are fighting one battle, the nurses on the other side, clinical officers. I think this is also a perfect divide and rule so that when there is not a consolidated voice speaking as one and saying, as Gabriel is saying, as my brother Gabriel is saying, we need to dialogue. How do you dialogue when there's so many voices out there? But bottom line, our doctors are dying. And a doctor who is dead, a nurse who is dead, a clinical officer, a healthcare frontline worker who is dead is not able to save lives. And this is a high priority issue that we are not able to respond to. Why isn't the government releasing PPEs? Again, and pick it back to the KEMSA scandal, where are the PPEs? I do not personally think that President Uhuru Kenyatta wants to see healthcare workers die, but I would challenge him and say his beautiful quantitative statistics around isolation beds and the number of isolation wards and the ICU beds and so on do not reflect the reality on the ground. Even now, with this second wave of the pandemic hitting us, hospitals are full. People are unable to access that care. And if we have so few health workers working to save lives, and these are the same ones we do not care for, we do not provide commensurate support in terms of remuneration, in terms of insurance, in terms of benefits. When they die, when they're ill, what happens to their families? This is a shame. This is a crying shame. And the thing is, we will continue to speak in terms of statistics and what we have achieved, but the healthcare workers will continue to suffer. So this is such a problem. And whether it's Dr. Mogusu and all the other medics who have lost their lives in the line of this pandemic, I just want to offer my condolences. And I say it is a really big shame. and the systematic corruption in the healthcare sector will continue to ravage us until we address that particular issue, graft and theft, and the fact that there are no consequences. We shout, we make noise, there are investigations, but nobody has gone to jail.
Right.
Funds have not been returned. PPEs are not being distributed. So it's a big problem, Akisa.
Okay, Gerald. I know, Caroline, you'll have a thing or two to say about how we've handled healthcare, but you also left it at the education system, the lost school year, as we've termed it, throughout 2020. How has the government, how did the government rather handle the education sector, the closing of schools, the disruption of the calendar, curriculum? Is it a hit for them or a miss?
Right, thank you, Akisa. And I think I would say that the two largest casualties of the pandemic, if you ask me, have been the health sector and the education sector. And I think the way we have responded to the issue of doctors is a blot in how we have fought the pandemic. But then again, we know, as my colleagues have mentioned, that it didn't start with the pandemic. These issues have been discussed since 2017, the aspect of public hospitals and the quality of public hospitals. But going back to the education sector, did we respond well? I don't think so. I think we have failed our young people, and we have seen the consequences of that. We are seeing in high rates of teenage pregnancies. We've seen this week, we are talking about the case of two girls impregnated by their father, which speaks about the issue of domestic violence, the issue of incest. But most importantly, I think the pandemic has just widened what was already an existing equality gap between the rich and the poor in terms of access to education. And I did mention earlier when I started that some of the challenges that we are facing now have just been more pronounced because of the pandemic. But we failed. We failed from the start when we spoke about digitalizing the education sector, and yet we didn't put the systems in place. We continue to fail when we speak about preparedness to open, but we are still not certain about the quality of the classes, the quality of preparedness, the quality of desks and availability of desks for the children when they go back to school. We've not been very specific about how, when schools open, we are going to protect the children, we are going to protect the parents, and just how we have managed to make sure that no child is left behind, even within the pandemic. Thank you.
Gabriel, do you agree with Caroline Gaita that we failed from the word go in as far as addressing issues arising in the education sector?
I think Caroline has actually mentioned some key pertinent issues which probably happened because of oversight. But, you know, remember what I told you, Akisa, this pandemic got all of us flat-foot. So I did not expect, you know, even the education sector to have had gotten a head start out of this pandemic. But one thing that's coming clear, as what Caroline is saying, have we or are we doing enough? Do we exactly know some of the protocols that are going to be laid out there before our kids go back to school? See, I've always said that I do not think we may have this problem per se, or this problem will generally be major at classroom level. My major concern is these children, when they leave home, that period before they get to school, Akisa, let me tell you, there is so much that happens within that period. Look at an informal sector, an informal settlement, if you will, like Kibra or Madare or Mokuru. Before these kids get to school, they've already had an hour of playtime at the nearest football field. So when they come to school, if there was any, if there's one person or one child who was going to, to spread COVID around, they've already done that. So when they arrive at school, it's a given. So to me, I think more concern should be put on the period when they leave the house and that period before they start class. That period is very tricky. And if we find a way to actually, mitigate that period, then probably it'd be fine. Remember also, these kids are going to be using public transport, whether it's matatus, whether it's buses. How are they going to be protected? And here I'm talking about the younger children, if you will, the class 1, 2, 3, they are, 6, the lower primary. So it is a concern. Now, Akisa, I am, just like what the president said, all parents are really looking up to the government and to the president in this instant. This is where they are looking up to the president for leadership. And he has said they've done the best, they've set up the best protocols. So all of us are looking up to him. I really hope the people who are helping him roll out these protocols are going to be very hands-on, because let me tell you, if it goes any other way, Akisa, it will be disastrous.
All right, I'd like us to take a quick break. Jaratich will be giving us your views on the education sector when we get back from the break. But also, the BBI has formed the basis for conversation in the political space and beyond this year. Let's take a look at how the political class has driven this agenda, and especially amidst a pandemic. Was it cognizant with the suffering of Kenyans, and especially now the cost of amending the Constitution and what we expect? We'll be back with that conversation. Remember, you can be part of this by logging on to slido.com. Event code is #TheFrontRow. You can as well tweet us at Akisa Wandera at KT News KE. The hashtag to use is #TheFrontRow. When we get back, I'll also be taking a look at some of your thoughts. I can already see a stream of messages coming in, so we'll be taking a look at that and more. Stay with us. This is The Front Row.